Hello and welcome. Let's continue answering questions that might come at the Prometric exam for pharmacy. A patient presents with a prescription for fluoxetine. Which of the following conditions is fluoxetine primarily used to treat? A. Anxiety disorders. B. Bipolar disorder. C. Major depressive disorder. D. Schizophrenia. The right answer would be C. Major depressive disorder. Fluoxetine is a selective serotonin reuptake inhibitor (SSRI) primarily indicated for the treatment of major depressive disorder and is also used to anxiety disorder, obsessive compulsive disorder, and bulimia nervosa. Next, which of the following is the primary adverse effect associated with the use of statins? A. Hyperglycemia. B. Myopathy. C. Cough. D. Constipation. The right answer will be B. Myopathy. Statins can lead to muscle-related adverse effects, including myopathy and, in rare cases, rhabdomyolysis. Regular monitoring of muscle symptoms and liver function tests is recommended. Next, what is the mechanism of action of losartan, an angiotensin II receptor blocker? A. Inhibition of AAC angiotensin converting enzyme. B. Blocking the action of angiotensin II at its receptor. C. Direct vasodilation of blood vessels. D. Increasing aldosterone secretion. So the right answer will be B. Blocking the action of angiotensin II at its receptor. Losartan works by blocking the binding of angiotensin II to its receptor, leading to vasodilation and reduced blood pressure. Next, a pharmacist receives a prescription for a patient who is allergic to penicillin. Which of the following antibiotics should be avoided in this patient due to potential cross-reactivity? A. Azithromycin. B. Cephalexin. C. Doxycycline. D. Metronidazole. The right answer will be cephalexin. Cephalosporin can have cross-reactivity with penicillin in some patients, although the risk is lowering than previously thought. Well, caution is advised when prescribing this class of patients with penicillin allergy. Next, which of the following is a common side effect of corticosteroids? A. Hypertension. B. Hypoglycemia. C. Osteoporosis. D. Both A and C. The right answer will be hypertension and osteoporosis. So it's D. Both A and C. Corticosteroids can lead to hypertension and osteoporosis with long-term use. Monitoring and preventive measures are essential for patients on chronic corticosteroid therapy. Next, a patient presents with a prescription for levothyroxine. Which of the following counseling points should be emphasized? A. Take it with food to enhance absorption. B. It should be taken on an empty stomach. C. Take it at bedtime for best results. D. It can be discontinued once symptoms improve. The right answer will be B. It should be taken on an empty stomach. Levothyroxine is best absorbed when taken on an empty stomach, typically 30 to 60 minutes before breakfast to ensure consistent therapeutic levels. Next, which of the following vaccines is recommended for all adults aged 20, 65 and older? A. Influenza. B. MMR. C. Varicella. D. HB. The right answer will be A. Influenza. The influenza vaccine is recommended annually for all adults, particularly those aged 65 and older, due to their increased risk of complications from influenza. Next, a 70-year-old female with a history of osteoporosis is prescribed calcitonin. What is the primary mechanism of action of this medication? A. Inhibits osteoclast activity. B. Stimulates osteoblast activity. C. Enhances calcium absorption in the intestines. D. Decreases renal calcium excretion. So the right answer would be A. Inhibits osteoclast activity. Calcitonin inhibits osteoclast activity, reducing bone resorption and helping to maintain bone density in patients with osteoporosis. Next, in the event of anaphylaxis, which of the following is the first line treatment? A. Antihistamine. B. Corticosteroids. C. Epinephrine. D. Albuterol. So the answer will be C. Epinephrine. Epinephrine is the first line treatment for anaphylaxis, acting quickly to reverse severe allergic reactions and restore normal blood flow. Next, which of the following best describes the term half-life in pharmacokinetics? A. Time required to reach peak concentration. B. Time required for the drug concentration to decrease by 50%. C. Time taken for drug to be completely eliminated from the body. D. Time from administration to onset of action. So the right answer will be B. Time required for the drug concentration to decrease by 50%. Half-life refers to the time it takes for the concentration of a drug in the bloodstream to reduce by half, which helps in determining dosing interval. Thank you so much for watching the video. Please don't forget to subscribe, like, and share. And wait for us for the next part to continue answering the question. See you soon. Bye.